Welcome to Health Time with Nurse Beckie. My name is Beckie Freiberg, and I am the faith community nurse here at Derry Presbyterian Church in Hershey, Pennsylvania. Today we are talking about advanced directives. Today my guest is Julie Groh, a nurse certified in public health. Julie and I worked together when I was in community health at Penn State. We have remained in touch, and I am so excited for her to be here for this conversation. Julie has been working for a long time in educating the community about advanced directives and is very passionate about teaching. Today we're going to be having a conversation about advanced directives, and I will be asking her questions and she will be giving me answers. Julie, is there any more that you'd like to add?
Well, I'd like to thank you, Beckie, for having me here. And it's very appropriate for April. April 16th is National Healthcare Decision Day, where we are encouraging people to have advanced directives in place. So this is perfect timing.
Oh, great. Well, then let's get started with the questions. Okay, Julie, what is advanced care planning?
Advanced care planning is just what it says. It's planning your care in advance. When we are able to, when we're sick, or we're able to talk to our primary care providers, our loved ones about what we want, we do that. But when we can't speak for ourselves, that's when we want to have advanced care plans in place, so we still get the care we want. So that's what advanced care planning is, having your plans in place.
Okay, I've heard about advanced directives. What is an advanced directive?
So there's a lot of terms that we use synonymously. Advanced care planning, advanced directives. There are three main types of advanced directives, which are also advanced care plans. There's a living will, there is a healthcare power of attorney, and a POLST, physician's order for life-sustaining treatment, which we won't talk too much about that one today, I can imagine, right?
Yeah, I've seen that on people's doors.
Yes. Yeah.
Okay.
I think we talk about that, we'll get into that later, just briefly.
Okay. And are there different types of advanced care directives available?
Yes, so like I said, one is the healthcare proxy or healthcare power of attorney. It's also called choosing your healthcare surrogate, choosing your healthcare agent. You see all these different terms, and they're all kind of the same thing. And so that is basically choosing someone who's going to make healthcare decisions for you in the event that you are unable to make them yourself. And then there's the living will.
Yeah, what's the difference between a living will and a will?
Well, a will is when you die, you have the will that's going to take care of your assets and your financial things like that.
So that would be after death.
Correct.
Okay.
And the living will is only, right, that's a good way to put it. Living will is when you're living, right?
Okay.
And that's related to your healthcare decisions. So that could be related to treatments that one would want at the end of life, such as resuscitation, CPR, cardiopulmonary resuscitation, a ventilator, like being put on a breathing machine. It could include things as being on dialysis, receiving antibiotics, having a feeding tube, IV nutrition or hydration. All those different things can be dictated in a living will.
Okay. So could you please describe the difference between a durable power of attorney and a healthcare power of attorney?
So they are different. So a healthcare power of attorney is only related to your healthcare needs. That's a person that you choose. Ideally you choose, because we'll talk about that. If you don't choose, somebody's going to choose for you.
Okay.
You choose someone who, if you are unable to make medical decisions for yourself, this person would make the decisions for you. So it's only related to medical stuff. It only comes in play when you are unable to make decisions for yourself. But you need to have it in place before then, right?
Right.
And a regular durable power of attorney is, somebody who could, do all your financial stuff and other non-medical.
But they could be
things.
the same person?
Could be the same person, absolutely, yes.
Okay.
They're just different things, but they're two different
Okay, so
things,
they're two
yes.
different.
Mhm,
Okay.
Yeah,
So how do you pick your healthcare power attorney?
very carefully.
do you need a backup person?
Yeah. Not a bad idea. So remember, this person is going to make decisions for you if you aren't able to make them yourself. So you want this person to know what you would want, right?
Yeah.
And how are they going to know what you want? Is you need to have a lot of conversations with them. They need to know you well. You need to choose someone that you trust. You need to choose someone that's going to be available. You need to choose someone that's going to be able to make tough decisions in a tough situation and think for you, not what's best for them. What they think is best is not right. You want to choose someone that you know will make the decisions that I tell them, things are important to me, that they will make those decisions.
So somebody who would advocate for your wishes.
Absolutely, yeah. And it may be a spouse, it may be a family member, it may not be. That might not be the best person if you know that person wouldn't
My
let
daughter.
you go. Yeah.
Like my daughter. Yep.
And also you need to have someone who's willing to do it. That's really important.
Yeah.
You don't surprise somebody. Please don't surprise somebody that they get a phone call and say, do you know you're the healthcare power of attorney? Because studies have shown that when people are asked, okay, they're chosen as a healthcare proxy, and they give answers as to what their loved one would want, that they don't necessarily jive because they haven't had those conversations. So
Okay.
it's really important to have these conversations about what your values are, what your wishes are, what your goals are in life as well as in death.
How much does it cost to draw up an advance directive?
Well, it could be nothing, or you could spend a lot of money on it, but
Ooh.
you don't have to spend anything. And I say that because you could have it done with a lawyer, and no offense, lawyers, but you'll probably spend a lot of money, right?
Yeah.
But all that is needed is there are free forms for that need to be signed by the person, the individual, and witnessed by two other people. So they need to be signed and dated, witnessed and dated by two other people, and those people can't be involved in your health care, and they can't be your healthcare proxy, the person you choose.
Okay.
And those forms are readily available, so you don't need to pay anything for them.
Well, how does one go about creating an advance directive?
So really, I'd like to emphasize that most important thing to get started is to really think about your wishes, your goals, your desires, what's important to you in life and death, and to have conversations with your loved ones. And then once you decide who is going to be your healthcare proxy, you talk to that person, make sure they're okay with it, and then it's a simple form. Like Penn State Health has a simple one-page form where you fill out your name, the healthcare advocate's name and address, and then alternate. You asked about, should you have more than one? Sure, because if you choose someone that isn't available, maybe they're on vacation in Europe or something when you're needed. Well, that's not real helpful. So having a backup or having two backups isn't a bad idea. And then, so it's that simple form, and then sign, date it, and have two witnesses.
Okay.
And then same with the living will is a little bit more complicated, only in that there's so many options to choose on treatments and resuscitations and things that you may want, may not want towards your end of life.
How legally binding are these advance directives?
They are legally binding in all 50 states.
Ooh.
Yes.
So if a family member, or say that you have an advance directive and another family member doesn't agree with it?
So, good point. Once you choose your healthcare proxy, you have your living will, what you need to do is keep that original someplace safe, yet easily accessible. Okay, not in the lockbox at the bank.
Okay.
And you need to know where it is. Then you need to give a copy to your healthcare proxy, to your primary care provider, to hospitals in your area, maybe where you may receive care. We have so many hospitals around here, and if you were in a car accident and Penn State Health is your main place, but your hospital is closer or something,
right.
It's not a bad idea to send a copy just to medical records so it's there, and
Okay.
then they start a record for you. So I was getting off track. If family members, that
Right.
was the question, yes.
Yeah.
So also, I think it's very important that you not only talk to the person who's going to be your healthcare advocate, but others who may think that they should have been the advocate and aren't.
Okay.
So that it's out in the open,
Okay.
that, I'm choosing my one son, like I have all three sons here, I'm choosing you as the main person to be my advocate. So the other ones, no, don't cause fights. That makes sense.
And we all know that
yeah.
can happen. Okay.
Did that answer your question?
Yes,
about,
it did.
Yeah, okay.
Yes, it did. And how are advance directives used in situations where an individual may be incapacitated?
Well, that's only when they're used, actually, because as long as a person can make decisions for themselves, they should make their own decisions.
Okay.
It's just when they're incapacitated. I think maybe you mean like a short-term thing.
Right.
Yeah. If they're in surgery or something, they're not expected
Right.
to be end of life. They could come into play, but in general, it's like, when they're not going to be able to make
Okay.
decisions for themselves is when it is to be used.
Okay. So how does having an advance directive contribute to the overall quality of healthcare decision making and patient autonomy? Good one.
Yeah. That's a great one, because that's the whole point, is to have some autonomy, to have your wishes followed through. And how is your healthcare team going to know what those wishes are unless they're out there? Unless you have that conversation with them, unless it's in writing, unless your loved ones who are going to be at your side advocate for you and let them know. And it's also helpful for the family members, the loved ones, because studies have shown there's less guilt, there's less confusion, there's less stress. Did I do the right thing? Is this what Mom really wanted?
Yeah. I could see that could be a real issue.
Sure, but if it's clear,
Right.
Okay, I know I did the right thing. This is what she told me she wanted.
Right. And it's in writing.
And it's in writing. And we've had those conversations.
Yes. What type of medical decisions can be addressed in an advance directive?
So medical decisions in an advance directive, like a living will, that could be, I touched on it briefly, if you are unable to make decisions for yourself. You're, say, in a coma, doctor doesn't expect you to ever recover. Would you want a feeding tube placed, or would you not want a feeding tube placed to, have you live longer, or just have a natural death? Yes. Would you, if your heart stops, do you want your chest, compressed on, or not? Do you want to be on a breathing tube? Do you want everything done or nothing done? Let me just have a natural death. So those medical things, if you dialysis or Or it can be very specific,
Mm-hmm.
just oral nutrition, just IV nutrition, and it's really difficult because we really never know what those situations are going to be.
Yeah.
So that's why it's really important. Again, have I said this a few times about having those conversations so your loved ones know what you want, what would be important, so they understand, because we can't really plan out every single possible scenario in a
Right.
medical situation, as you know.
Yep, as I know.
Yeah.
So it's so important to have those conversations and have it out in the open.
Yeah.
Yes.
Not easy to do, though.
No, it's not.
People don't like to talk about it.
No. Well, how does an individual ensure that their healthcare providers are aware of an advance directive?
Guess what I'm going to say?
I know.
Have that conversation.
Have the conversation.
So actually, there is, I forget what it is, Act 160. It is, by law, you can make an appointment with your doctor to only discuss your advance directives.
I did not know that.
Yes, because the physicians are so busy, your appointments
Yeah.
never seem to be long enough, so you can make an appointment just specifically to talk about that. It is a billable billable
Yeah.
appointment. Yeah.
Yeah.
So, and then make sure they have a copy of it to put on your records.
Great. That's good information. I didn't know that.
Mhm.
That was something. And are there any limitations or restrictions on what can be included in an advance directive?
I suppose if something is,
Say if they want an illegal,
I was going to say
Yeah.
illegal or immoral
Yeah.
or
something like
that's
that.
asking. Yeah, you can't ask your healthcare
Okay.
team to be breaking laws or
Okay.
yeah.
Because there's like some different kinds of cancer treatments that are legal elsewhere, but not in the U.S.
Right. Yes, like
So-
maybe some super experimental thing
Yeah.
might be.
Okay.
And if there's question, there be that conversation with family, loved ones, or sometimes ethics team has to be pulled in.
Yeah. Yes. Okay.
Mhm.
Okay. And what role do family members or appointed agents play in relation to an individual's advance directive? Family members.
Again, I think it's really important that family members are aware, especially family members who may not be listed as their advocate or their representative, so they know that the loved one, the individual, has spoken to who is their spokesperson, and that spokesperson is the final say, or to
Okay.
speak in their what's the word I'm looking for? Place.
Yeah.
Yeah. Thank you.
Okay, and are there any circumstances that an advance directive may not be followed?
Well, if a person doesn't choose the right person, really,
Yeah.
that it might not be followed. Again, if if they are legally binding, they should be followed. So I don't want to give the impression that why am I going to do this if it's not going to be followed? It should be followed. But,
Okay.
I suppose if there's massive infighting or
For family differences and things
yes,
like that.
yeah, but they, I'd like to say that they are legally binding and they should be followed.
Okay. Are there any specific legal requirements or considerations regarding advance directives in Pennsylvania?
So just for Pennsylvania, it needs to be signed and dated by the individual and then witnessed by 2 other people. It's not required to be notarized. Some people
I was just going to
want to
ask
do
that.
that for the extra, secure stuff. It can be done through a lawyer. The first ones we did through our lawyer, before I knew much
Yeah.
about it, really. Yeah.
Yeah.
And she kept the original safe and secure in her office.
Oh.
Yeah.
Easily accessible.
Right. Not.
Yeah. And how does having an advance directive impact end-of-life care decisions and medical treatments?
Well, it's going to ensure that the individual gets the care that they want. They'll be more satisfied with their care. Again, family members are more satisfied. And getting the care you want is the ideal thing, right?
Right.
Yeah.
That's the whole goal of it.
Mm-hmm.
Right. And what resources are available for people seeking assistance in creating an advanced care plan?
People could check with their primary care provider. All healthcare systems should have copies of advanced directives. The PA.gov has the Pennsylvania State Living Will. Penn State Health, there's a link on the website for advanced care planning. I brought some brochures and flyers, some information today that you could leave in your parish somewhere for some more information.
Thank you for that. Yeah. And how often should an advanced directive be reviewed or updated?
Glad you asked.
Yeah.
Because when I bring this up to people, I hear, "Oh, I already did it." Well, when did you do it? When I got married 40 years ago.
Oh boy.
So they should be reviewed regularly. Ideally, anyone over 18 should have an advance directive.
Oh really?
Yes. Once you turn 18, you're an adult, right?
Yeah.
Parents
I guess
can't
you're
just
right.
make a decision for you. So, and that should be super simple, right? In general, most 18-year-olds are young and healthy, so you'd probably want to do everything possible, right?
Right.
Maybe once any significant life events, like a marriage, birth of a child, a divorce,
Ooh.
yes, a new diagnosis, a new disability, death of a loved one. Perhaps your healthcare proxy is no longer able. So every few years, it should be reviewed. It might not need to be changed, but it should be reviewed. Typically, they will be changed as we age. Something I would have had when I was 18.
No
It's a
longer
little
applies.
different, yeah.
Yes, and as we know more. Okay, can an advanced directive be modified or revoked?
Absolutely, yes. So, and because I just mentioned several reasons why, right? If you
Right.
update it, it can be revoked. They suggest getting the original, writing revoked, and contacting anybody that you gave a copy to, asking for it back, shredding it, or writing revoked on it. So that's important to keep a list of where your copies are.
Oh, that's a good idea, yeah.
And then a new one is just made. And if there are two out there floating around, the one with the most recent date, as long as it's been signed, dated, witnessed by two people, then that would be the most current one.
Okay.
Mm-hmm.
So, I've made a living will and a health care plan of care. So what do I do? What do I do with them?
So you will give one to keep the original. Find a nice, safe, secure place where
Easily
easily
accessible.
Thank you. For the original.
Okay.
Give copies to your healthcare proxy, your healthcare advocate, surrogate, whatever you want to call them. They have so many names. A copy to your primary care provider. Get it to your medical records. Maybe for medical records for nearby health systems.
Yeah.
Because I'll tell you a story in a second. And your loved ones, make sure your loved ones all know, and continue those conversations.
Okay.
Continue those conversations.
That sounds good.
In that, I bring up about the other health systems because a friend recently, a family member, they live locally, the man gets his care at the VA has everything in place. His healthcare advocate and his living will is on his records at the VA, but the ambulance came to take him and they didn't think that he would get that far. His wife wasn't in the ambulance with him. She had the living will at a safe, secure, easily accessible place, but went in the car behind them. They didn't know it. They had to go to a closer health system. And, when someone comes in the ambulance without anybody with them or paperwork, they're going to do everything they can to save them.
Absolutely.
So that was really hard for her. She had to say he didn't want these things. That was a strain. So, it's not a bad idea to get it in medical records at nearby.
Yeah, as many places as
where you may go,
Yeah, that sounds
Some people
good.
suggest keeping one in your glove box if you travel, you're driving, or make a little wallet card in your wallet that says, I have an advance directive, this is who you can contact, or this is where
Oh,
it
that's a
can be
great
found.
idea.
Yeah.
Great idea.
Because we don't, when you really need it.
Yeah.
Yeah.
It may not be available.
Right, best
there.
laid plans, right. So.
Right, best laid plans. And can an advance directive address preferences for pain management or palliative care?
Yes, absolutely, yes. And that, it can really include so many things, anything related to comfort, or religious preferences even, or if you want certain music playing,
Oh, wow.
towards the end of life. Really anything you could think of that's important to you. And that's why having conversations to think about what's important in life, like that's how people think about what their values are, and how they may want to incorporate that into a living will. There is one particular advance directive, it's kind of a one in all, called My 5 Wishes. And it incorporates who your healthcare proxy is, how you want to be at the end of life, comfort measures, what's important to you. There's 5 things.
Yeah.
I have a copy, I'll show you.
Okay.
That. It's not off the top of my head, but
Yeah. I recently heard of this guy who did not want any pain medication, did not want any kind of medication at the end of his life, and that was in his health care advance directive. And family members did, and they said it was horrible because he was in such terrible, terrible pain. But that's what he wanted, and they did honor it.
Wow.
Yeah. Ugh.
Well, that's a really good point that the way you said that, you probably wouldn't choose that. I don't think I'd choose that either.
Right.
And so we don't know unless
somebody,
we tell somebody, So
And so he did. He had that in
Yeah.
his advance directive.
good for him and his family. I'm
Right.
sure that was terrible to watch.
Yeah, they said that it was terrible to watch, but that's what he requested and that's what he wanted.
Mhm.
So, and how does an advance directive interact with organ donation?
That can be included, that you want to be an organ donor or donate your body to science or anything, that could be included as well.
Okay.
Yeah. Mm-hmm.
And can an advance directive be utilized in situations where temporarily incapacitated? Like say somebody is going to surgery and they find, say a cancer or something, and they have to take out an organ, but that person is not awake and has not signed for that. Could advance directive deal with that?
I
Or say somebody,
think
You-
so.
they had to remove a limb? I don't know.
Yeah, usually before surgery, there's going to be
Written consent.
written consent with all the possibilities.
Okay.
But ideally before then, it would say, my healthcare proxy is here. If something comes up, you certainly can talk to them while I'm under.
Okay. And let's see, how does one ensure that their advance directive is accessible in case of emergency or medical necessity? I think we kind of already covered that. Keep it available, readily available.
Yeah.
And then, are there any potential conflicts between an advance directive and the wishes of a legally appointed guardian or healthcare proxy? So I think what I'm asking here is if it comes down to that the healthcare proxy person doesn't agree with what you wanted, or even maybe the healthcare team says, no, we could do better.
Well, that would cause conflict. Again, I'd like to say if that person made that advance directive and was, completely lucid when they made it, that their wishes would be honored.
Okay.
Yeah.
So that would go along with disagreements within the family.
Yeah. Again, have those conversations.
Right. Okay.
So, okay, go ahead.
Let's see. And how does an advanced care directive account for unforeseeable medical advances or changes in the treatment options?
Typically, the wording is, could be broad enough that things could be covered within the realm of the wording to do that. Again, another reason to review it every few years,
because there's so many major changes that are happening all over, and so that would need to be reviewed, updated and reviewed.
Yeah, and there's something to say about keeping it vague enough so that it's not so pinpointed. Again, have those conversations.
Have the conversations.
If we're having this conversation and that I am all about experimental stuff, and you're my advocate, you'd be like, she'd want you to do it, then go for it.
Right. Okay, so this is not easy to talk about, the end of life issues. So how do we get started?
It's not easy to talk about.
No.
My family kind of thinks I'm obsessed with death because I'm always bringing it up. And I've even had trouble. Sometimes you have to be creative. A couple years ago, my kids all got an advance directive in their Christmas stocking when we were home together.
Julie, that's a great idea.
I said, all I want for Christmas, while everybody's home this week, is one evening where we sit around the dining room table. Yeah, that was a blast. But it worked. It started it, So
okay.
now we joke about it, because it's not a once and done conversation either.
It's ongoing.
It's ongoing. Things change, right?
Mm-hmm.
And you're well aware, I'd love to have the opportunity to talk about the Hello Game. A Hello Game.
Yes.
It's a fun conversation game where people sit in small groups and we have a little booklet of questions that we talk about, and it helps to break the ice of having people think about what is important to them in life and in death, and in ways to start having this conversation in a non-stressful environment, because in the ICU with your loved one,
that's not the time.
That's not the time to have the first conversation. Nobody's thinking straight. It's so stressful.
And emotional.
Yes. And those emotions are running high, and
we know how much good decisions are based on emotions.
Right. So start early and often.
Okay. Well, Julie, thank you for coming and sharing your information with us. I really appreciate this, and I think this is really going to help.
Yeah, thanks.
So thank you.
There was one thing I meant to mention, that if you don't have a healthcare proxy, right? Mm-hmm. You don't choose your healthcare power of attorney, advocate, surrogate, whatever you're going to call it. and you're in that situation where you can't make your decisions, somebody's going to make them for you. And they might not be what you want. So the state of Pennsylvania does have a hierarchy on who to go through. So if there isn't anybody designated, it's going to be a spouse and an adult child of a previous marriage, if there is one.
Okay.
So right there, I could see conflicts.
Yes. Yes.
So that would be the first level. Then it would be an adult child, and then a parent.
Yeah.
An adult grandchild. I think I have the right order. But anyway, there is a hierarchy that, it's made. So, we talked about marriage and divorce. So if there hasn't been updated and it's, that original spouse is listed, maybe that's not the person somebody wants making decisions for them.
Right.
Yeah.
Yeah, that could be a problem. What could possibly go wrong?
Yeah. Right.
So anyway, thank you, Julie, for coming
You're
and
welcome.
talking to us about this. And I'm going to invite you back to play the Hello game.
Great.
Yeah.
Looking forward to it. Thank you.
Thank you. Okay, I believe that everyone should have an advance directive. It takes the burden of carrying out your wishes from your family or loved ones. It truly is a gift from you to them. The Health and Wellness Committee has discussed bringing more information about advance directives to our congregation. Kathy Hedrick will be speaking at an issues class, and the date is to be determined, but I'll let you know when that is happening. If you have any questions on how to get started on making an advance directive, you can go online and search advance directives for the state of Pennsylvania, or you can contact Julie or me for more information. And for more information about this topic and others, you can contact me here. Peace be with you.